British serial killer Harold Shipman attended Leeds School of Medicine and began working as a physician in 1970. Between then and his arrest in 1998, he killed at least 215 and possibly as many as 260 of his patients, injecting them with lethal doses of painkillers and heavy sedatives. Born in Nottingham, England, as the middle child into a working-class family on January 14, 1946, Harold Frederick Shipman, known as Fred, was the favorite child of his domineering mother, Vera. She instilled in him an early sense of superiority that tainted most of his later relationships, leaving him an isolated adolescent with few friends. When mother was diagnosed with terminal lung cancer, he willingly oversaw her care as she declined, fascinated by the positive effect that the administration of morphine had on her suffering, until she succumbed to the disease on June 21, 1963. Devastated by her death, he was determined to go to medical school, and he was admitted to Leeds University Medical School for training 2 years later, having failed his entrance exams the first time before serving his hospital internship. Still a loner, he met his future wife Primrose at the age of 19, and they married when she was 17, and 5 months pregnant with their first child. By 1974, he was a father of two and had joined a medical practice in Todmorden, Yorkshire, where he initially thrived as a family practitioner, before allegedly becoming addicted to the painkiller pethidine. He forged prescriptions for large amounts of the drug, and he was forced to leave the practice when caught by his medical colleagues in 1975, at which time he entered a drug rehab program. In the subsequent inquiry, he received a small fine and a conviction for forgery. A few years later, Shipman was accepted onto the staff at Donnybrook Medical Center in Hyde, where he ingratiated himself as a hard-working doctor who enjoyed the trust of patients and colleagues alike, although he had a reputation for arrogant junior staff. He remained there for almost 2 decades, and his behavior incurred only minor interest from the other healthcare professionals. The local undertaker noticed that Dr. Shipman's patients seemed to be dying at an unusually high rate and exhibited similar poses in death. Most were fully clothed and usually sitting up or reclining on a sofa. He was concerned enough to approach Shipman about this directly, who reassured him that there was nothing to be concerned about. Later, another medical colleague, Dr. Susan Booth, also found the similarity disturbing, and the local coroner's office was alerted, who then contacted the police. A covert investigation followed, but Shipman was cleared, as it appeared that his records were in order. The inquiry failed to contact the General Medical Council or check criminal records, which would have yielded evidence of Shipman's previous record. Later, a more thorough investigation revealed that Shipman altered the medical records of his patients. Hiding behind his status as a caring family doctor, it is almost impossible to establish exactly when Shipman began killing his patients, or indeed exactly how many died at his hands, and his denial of all charges did nothing to assist the authorities. Indeed, his killing spree was only brought to an end thanks to the determination of Angela Woodruff, the daughter of one of his victims, who refused to accept the explanations given for her mother's death. Kathleen Grundy, an active, wealthy 81-year-old widow, was found dead in her home on June 24, 1998, following an earlier visit by Shipman. Woodruff was advised by Shipman that an autopsy was not required, and Grundy was buried in accordance with her daughter's wishes. Woodruff was a lawyer and had always handled her mother's affairs, so it was with some surprise that she discovered another will existed, leaving the bulk of her mother's estate to Dr. Shipman. Woodruff was convinced the document was a forgery and that Shipman had murdered her mother, forging the will to benefit from her death. She alerted the local police, where Detective Superintendent Bernard Postles quickly came to the same conclusion upon examination of the evidence. With Grundy's body exhumed, a post-mortem revealed that she had died of a morphine overdose administered within 3 hours of her death, precisely within the time frame of Shipman's visit to her. Shipman's home was raided, yielding medical records, an odd collection of jewelry, and an old typewriter which proved to be the instrument upon which Grundy forged will had been produced. It was immediately apparent to the police from the medical records seized that the case would extend further than the single death in question, and priority was given to those deaths it would be the most productive to investigate, namely victims who had not been cremated and who had died following a home visit by Shipman, which were given priority. Shipman had urged families to cremate their relatives in a large number of cases, stressing that no further investigation of their deaths was necessary, even in instances where these relatives have died of causes previously unknown to the families. In situations where they did raise questions, Shipman would provide computerized medical notes that corroborated his cause of death pronouncements. Police later established that Shipman would, in most cases, alter these medical notes directly after killing the patient to ensure that his account matched the historical records. What Shipman had failed to grasp was that each altercation of the records would be time-stamped by the computer, enabling police to ascertain exactly which records had been altered. Following extensive investigations, which included numerous exhumations and autopsies, the police charged Shipman with 15 individual counts of murder on September 7, 1998, as well as 1 count of forgery.